Hello, I'm Woodrow Wilcox. With this segment, I'm going to give you part of the lecture that I normally have given for over 15 years. At public functions, we get invited out. I get invited, and an agent from our agency gets invited. The agent talks about insurance, Medicare insurance, from an agent's perspective. I talk about it from an administrator's perspective. I did not take any course or any classes from Medicare to learn this stuff. I learned this stuff by helping our clients fight mistakes and fraud in the Medicare system. This is a chart about Medicare plus Medicare supplement. There's a new item for seniors, and that's called Medicare Advantage. That's a completely different system than what I'm going to talk about here. As you can see, there are many moving parts to this. When a senior citizen that has Medicare and a Medicare supplement goes to a doctor, a hospital, or some other medical service provider, then the medical service provider sends the claim to Medicare. And the Medicare system is basically a system combined of telephone lines, satellite lines, internet, email lines. So the hospital, doctor, or laboratory will send the claim to Medicare through a satellite. Then Medicare gets the claim, either the Medicare contractors or actual Medicare employees of the U.S. government. Then they send a Medicare, what's called an EOB, explanation of benefits, to the hospital, doctor, or laboratory, and to the insurance company. And they also send it, the MSN, what's called a Medicare summary notice, to the senior citizen patient. In any one of these places, something can go wrong and get the claim messed up. You have to hunt for what the problem is. I will tell you this, many times, Medicare will send claim information to the insurance companies, but they don't get it. Why is this? Well, think about it. Every time there's a storm, or every time there's a sunspot, your TV or other electronics may go wild. Okay? Well, it happens that it interrupts the telephone lines, satellite lines, and communication lines of the Medicare system. If they just stop and are killed for 1 second, there's an enormous amount of data that is lost. Okay? And many times, the insurance company doesn't get the claim. But the senior citizen, through a different path, may get the Medicare summary notice. If the insurance company does not get the claim information, they will not pay their portion of the bill, as determined by Medicare government offices. And many times, this kind of thing happens, and it happens for a variety of reasons. One of the reasons is when insurance companies send information to Medicare, Medicare does not update the information for a very long time. At times, I've had cases where it took 4 months to 3 years for Medicare to update their files. In 2019, a man from Miller Beach, Gary, Indiana, came to me with a problem. He was one of our clients, and Medicare thought that it was not his primary insurer. They thought he was still on a private insurance plan and that he had not yet come to Medicare. Well, the insurance company every month will send a list of their clients that are now with their company, and they want Medicare to send them claims information so that they can pay it properly. Well, in this case, the fellow in Miller Beach, Gary, Indiana, he got our help to send the information to Medicare. We helped him enroll with the Medicare supplement insurance company, and that company sent the information to Medicare. But Medicare never got it, probably because of some interruption in the line. So anyway, Medicare did not think that he had Medicare as his primary insurance. And because they thought that, they refused to pay any of his claims. Well, the man from Miller Beach, Gary, Indiana, that was our client, came to us for help. And I found out that he had a total of $41,243 of claims from hospitals, doctors, and so forth that were not being paid either by Medicare or his insurance company, Because if Medicare does not pay for something and they say it's not covered by Medicare for some reason, the insurance company, Medicare supplement insurance company, won't pay it either, because the Medicare supplement company, insurance company, is a supplement to what Medicare rules. The insurance company does not try to investigate or find out if it's covered or not. They rely on Medicare. That's why it's a Medicare supplement. So anyway, I helped the man from Gary to straighten out Medicare so that they knew he had already switched to Medicare. They just didn't have his information updated yet. And that's all it was. They got the information from the insurance company, but they never updated the files. So he was accumulating bills of over $41,000. And when he came to me, I investigated, found out what the problem is, and with his help, presented the evidence to Medicare. And then after 60 or 90 days, Medicare's records were updated, and we told the doctors, hospitals, and other medical firms to go ahead and refile the claims. And that time, the claims got paid by Medicare and his Medicare supplement. So in each of these cases, I have to try to determine where is the problem? Where did the ball get dropped? What are the pieces of the puzzle? And then I help senior citizens to fight mistakes and fraud in the Medicare system. And by the way, it's not usually fraud. There's very little fraud. It's just simply, it's a man-made system. It's bound to have flaws. It's bound to make it so that people make mistakes, do errors, cause problems. And I just simply try to put the pieces back together. And so far, I've been doing it for over 21 years, and I've saved the clients of the insurance agency where I worked over $3 million. And I want to teach this to many people. I'll turn 70 this year. I don't know how much longer I have to live. And I would like other people to start learning this so that when I die, my knowledge and my skills don't die with me. This can save senior citizens a lot of money, but somebody has to study it in order to help them. Thanks for listening. I'm Woodrow Wilcox.